And we are live.
Great. Okay, I'm going to admit everyone. Okay. Good evening, everyone, and welcome to the Trenton Alumni Chapter of Delta Sigma Theta Sorority Speakers Series with our focus tonight on heart health. The Health and Wellness Committee has planned an evening for you full of information and a little bit of participation to help us all understand the importance of heart health. We would like to welcome all of our Zoom and Facebook guests and invite you to ask questions at the end using your chat or comment feature. We will address all questions that have not been answered. Please note that all Zoom participants will be muted. We will also have an evaluation at the end that we ask and would appreciate that you would complete at the end of the session. Let us start by introducing our guest panelists for the evening. Dr. Renee P. Bullock Palmer, who is a board-certified cardiologist and specializes in and has a passion for multimodality cardiac imaging, as well as cardiovascular health in women. Among her accomplishments, which are numerous in the field of heart health, she is the director of non-invasive cardiac imaging, as well as the director of Women's Heart Health at Deborah Heart and Lung Center in Browns Mills, New Jersey. She is on the board of the Southern New Jersey American Heart Association and on the board of directors of the American Society of Nuclear Cardiology. Welcome, Dr. Palmer. We also have Mr. Darvin Henderson, who is a certified personal trainer, sports nutritionist, and AED CPR first aid certified by the American Heart Association. He will share how physical fitness affects heart health. Welcome, Darvin. We are also honored to have two warriors of heart health. First, we have Ms. Pamela Coleman, who has survived numerous challenges living with heart disease, but continues to make an impact on educating women about the risk of heart disease. Welcome, Ms. Coleman. And we also have our own soror, Angela Lee, who is a living testament to heart health survival. Both will share a little insight through their experiences. Welcome, soror. So let's get started. I will pose some questions to our panelists, and they will educate us on heart health tonight. We're going to start with Dr. Palmer. We're talking about heart health, and February is Heart Health Month. How is heart disease defined?
Great, thank you, Linda, and thanks again for the invitation this evening to speak about such an important topic. So heart disease is defined as any medical condition that causes a heart to not work well. This might be in the form of a blocked blood vessel of the heart, causing chest pains or shortness of breath, or could lead to a heart attack, and sometimes may even lead to a weakened heart muscle. You may also have a medical condition that causes the heart to beat in very weird rhythms, either beating too fast or too slowly. Sometimes this might need to be treated with a pacemaker. Sometimes they may need to have an electrical cardiac procedure. And of course, some patients may also have valvular disease of the heart, where the valve might be leaking too much or causing the valve to be very tight. And patients might present with symptoms like shortness of breath, chest pains, and even passing out. So there's a multiple ranges of diseases with the heart.
Wonderful, thank you so much. One question that always comes into mind is, what raises your risk for heart disease? How do you know that you're at risk?
Right. So I like to define, actually divide these in modifiable risk factors, meaning the risk factors that you can change, and non-modifiable risk factors, meaning that those are just risk factors that you were just born with, you cannot change those. The non-modifiable risk factors includes genetics. So if you have a family history of what we define as premature heart disease, where if you've had a first degree relative, such as a sibling or parent who is a male who has had a heart attack before the age of 55, or if they're females, if they've had that a heart attack before the age of 65, then you do have a family history of premature heart disease, and that increases your risk for heart disease. Of course, there's age. The older you are, the higher your risk for heart disease. And then there are modifiable risk factors, which means risk factors that you can change, such as smoking, which increases your risk, obesity, a sedentary lifestyle, if you have a history of high blood pressure or high cholesterol, or if you have a history of diabetes. So those are the major risk factors for heart disease.
Wonderful. Thank you so much. One of the questions that came in was, what are the risk factors for coronary artery disease? What does it mean to have blocked arteries?
Right. So those risk factors that I just mentioned are the major risk factors for coronary artery disease. So coronary artery disease is basically any disease that causes blockages in the blood vessels of the heart. This might be in the form of a ruptured plaque, where, I'm sure may have heard stories of patients who have just dropped suddenly from sudden death. Usually when that happens, there's a plaque that's within the vessel that just suddenly ruptures and closes the vessel very suddenly. Also, there is the presence of plaque that might develop over time. It's like asphalt, where you may have layering over a number of years of cholesterol, and then ultimately the vessel becomes blocked. And those in those patients, they might present less acutely. So they might present with just chest pains or even a weakened heart muscle. And sometimes they might even present with a mild heart attack. So that's the full breadth of coronary artery disease. And there's a full spectrum, because very early in the disease, you may just have very thin layering of cholesterol that doesn't cause any obstructive disease, doesn't cause any problems with blood flow. However, if that disease process goes unchecked, with increasing of the cholesterol and so on, that ultimately over time that plaque will get bigger and close the vessel off. So it's very, very important to catch and treat the disease early.
Wonderful. More people, I'm told, are surviving cardiac events, but not women. Why is this, and what can be done? I recently saw this in the article by the American Heart Association, women needing CPR too, which was the article.
So, there are multiple reasons why heart disease, is still and remains a leading problem and cause of death for women in this country. So actually, with regards to overall death rates, the death rates for men and women from heart disease are actually the same. Oftentimes there's a myth that women are less likely to die from heart disease, but actually they're just as likely as men to die from heart disease. However, what we are finding is that for younger women, such as women in their 40s and 50s, where they do present with heart disease, they actually have a higher risk than men of dying. The reason for that is because oftentimes it's underestimated both by the patient. You're thinking, I'm 42, how can I ever have a heart attack? This must be something else. And you may sit on the symptoms for weeks, months, and not seeking medical attention. The second part is that when you do present to the medical facility, it's also underestimated by the provider, because then the provider thinks, oh, this is a young female. This is someone who's been going to the gym 3 days a week. How could she be having a heart attack? So there's underestimation on both the patient side and the provider side. And of course, as women, we tend to be nurturers. We try to take care of everything else and then leave ourselves for last. And studies have shown that women are less likely to call 911 when they're having an emergency. So oftentimes by the time they seek medical attention, it's much later in the course of the disease. And because of that, there are increased risk of death by the time they do present.
Wonderful. So what are some of those signs that we as women should look for?
Right. So I usually tell patients, and as I had mentioned before in a previous presentation I was doing earlier this month is that I have oftentimes, instead of asking patients if they're having chest pain, I oftentimes ask patients if they're having chest discomfort or chest sensation, because there's a perception out there that chest pain that I should be worried about is usually the sharp sticking chest pain, but actually the chest pain that worries us most is the chest pain that comes on as a dull ache, heaviness in the chest, pressure in the chest, tightness of the chest. So for example, oftentimes I'll ask my patients, are you having chest pain? I'm like, no, I'm not having chest pain. And then I ask, are you having chest pressure? They'll be like, yes, I'm having chest pressure, not really thinking that that is actually a red flag for heart disease. So if you're having any chest sensation, particularly if it gets worse when you're stressed, when you're under physical endurance, then that's something that should clue you in that there's something wrong. The other manifestation might be shortness of breath, where patients are just not being able to do their activities that they would do normally because they're just breathless, they're fatigued. So if you could walk to the end of your street, a block, 2 months ago, and then now you're barely able to go half the block, then that's a red flag that there's something that's wrong. If you're having dizziness, especially if it's very frequent, and forgive me, that's my dog in the background barking, sorry. Right, so if you're having dizziness, particularly if it becomes increasingly worse, or if you do pass out, those are some of the symptoms. So heart disease is very varying, and I always tell my patients to never be shy about asking questions when you're seeing a physician. Even if you think it's a trivial question, it might be very important.
Very good, thank you. And I have one more question that it's kind of loaded, because we as African Americans, we know some of the things that we do, some of our habits, but I'm just going to ask these kind of together and let you elaborate to the areas that you feel are most important. So why is it more common in our population? What specific risk factors do African Americans have in regard to heart disease? And I think you touched on that a little bit.
Right.
Why are African American women more at risk? Right. Do we know what percentage of African American women die from heart disease? Right. And what can we do in the community to try to help each other as far as protecting ourselves from heart disease?
Right. So, African Americans on a whole we're 30% more likely to die from heart disease when compared to Caucasians. And the death rate for women as well is equally as high. And the reason for that is predominantly due to lifestyle. So as I had touched on earlier, the risk factors for heart disease are predominantly, linked to how we eat, how we live our lives in terms of activity. And the American Heart Association, and this is information that is privy to the general public. And if you go to hhs.org, and I'll share that in the chat, as well as the American Heart Association website, there's statistics that have shown that for African Americans as a population, we are more at risk for high blood pressure, diabetes, and high cholesterol. And the reason for that is the diet. So it's very important that even as early as in childhood, that children develop healthy eating habits, such as ensuring that you're having a lot of fruits and vegetables. You minimize your intake of animal fats, such as red meat, beef, pork, even eggs and milk. You have to be very restricted in your intake of these foods. And in addition to that, a healthy diet is also the importance of having a healthy lifestyle. So at least 30 minutes of exercise 3 or more days a week is a recommended standard. If you can get up to 5 hours a week, that'd be excellent. And then also, if you're diagnosed with any risk factors such as diabetes and high blood pressure and high cholesterol, it's absolutely important that you follow your physician's instructions with the medications. If you're disagreeing with being started on a particular medication, have that discussion with your physician. Always welcome any patient's hesitation with regards to medications, because it's best to have the discussion in the office and reach a compromise in terms of a solution to get to the same destination, which is, of course, a healthy heart. So I've had patients who will be diagnosed with high blood pressure, and they make sure they come in every 3 months, every 6 months to ensure that they're adequately controlled. So those are some of the reasons why, you know, our population on a whole have a higher risk. So it's not so much due to genetics, it's due to what we call social determinants of health, meaning that you know, as a population, we're less likely to visit the physician. And sometimes, of course, let's face it, when we go to see the physician, there's implicit bias as well. And also, you know, having access to as good healthcare as everyone else, right? Because I can tell you, I did my training in New York, in Brooklyn, and the difference is so stark when you're, you know, at an inner city hospital compared to when you're in the Upper East Side in Manhattan, right? And that's unfortunate. It really should not be like that. And what I encourage my patients is that if you're seeing a physician and you don't feel that you're getting your questions answered, if you feel that you're not, your symptoms are not being adequately addressed, you should be free and feel free to change and get a second opinion. You know, because no one deserves, you know, ill treatment in terms of medical care. And so it's very important. So those are some of the risks why, you know, our population has these higher risk factors. For women, there's one thing too that I always stress is your maternal health. So what was the health of your pregnancy? And unfortunately, again, you know, in terms of poor, you know, pregnancy care, that's something that has been linked to our population. Again, with implicit bias, also just awareness that, you know, the pregnant state is actually, in my mind, a marathon. It's like a stress test for your heart because it's 9 months, you know, your heart rate has wide swings in the blood pressure and the heart rate. And sometimes for some of us in pregnancy, things like preeclampsia, if you've had very high blood pressure in pregnancy, if you've had a premature delivery, those are some of the risk factors that indicate that in the future, you may be at risk for heart disease. So your cardiologist should be asking you about a pregnancy health, how was your pregnancies? And definitely if you're pregnant, definitely make sure that you're getting adequate care and that you're watching your blood pressure, your salt intake. So because of these increased risk with maternal health, that has also been linked to poor outcomes in our population for women.
Wonderful. Thank you so much. One final question for this part of the segment, and I'm not sure if you have touched on it a little bit, but what are the treatment options for heart disease? Most of the time we realize somebody had a heart attack and, you know, they end up with a heart transplant or some kind of major surgery and, you know, they end up scarred for life because that's, you know, what had to happen. So what are the treatment options when someone comes into the office and they've had some kind of heart distress?
Right. So, of course, the treatment is determined by the underlying cardiac condition that the patient has. If there's a blockage that's severe, then oftentimes that's treated with a stent. If it's very far gone and you've had multiple vessels in the heart that are involved, that might require open heart surgery to do bypass surgery. Sometimes if the buildup of the plaque in the vessels of the heart is not causing any blockage and just simply treating with medications such as being on aspirin, having, being on a cholesterol lowering medication, those are some of the medications that might be chosen. If you do have an electrical problem, depending on what that electrical problem is, if it's a very fast heart rate that requires what we call an electrical ablation to get rid of that area of the heart that's causing the rapid heart rate, that's usually an electrical procedure with laser and so on. That's done like in an electrical cardiac electrical lab. So that might be something that might be used for treatment. If it's a situation where the heart is beating too slowly and you have what we call an electrical heart block, where the top of the heart is not speaking electrically to the bottom of the heart, those patients might require a pacemaker. Of course, if the patient has a leaky valve that's severe or a tight valve that's severe, then that valve might need to be replaced. And that could be done with minimally invasive surgery, depending on the valve disease that you have, or it might be requiring open heart surgery. So those are some of the treatment options. I like to tell patients that the heart is like a house, right? You have the walls, the structure of the heart, of the house, which is the valve and the muscle of the heart. You have the plumbing, which is the blood vessels of the heart, and of course the electrical wiring of the host, which is like the electrical circuitry of the heart. So depending on what problem you have, you may call the plumber, you may call the electrician, you know, you may call the carpenter. So that's my that's my simplest way of looking at it.
Wonderful. So we'll give you a break right now, and we'll move on to our next guest, Bianca.
Good evening, everybody. This segment, we are going to bring in our second panelist, Mr. Darvin Henderson. Are you unmuted here?
Yeah. What's going on?
Hello, sir. Well, we're going to start the segment with, why is exercise important?
Why is exercise important, especially for heart health? As the body goes, the blood vessels, I mean, everything starts up at the heart area. So of course we know once that starts working and the blood stops flowing, you know, it becomes a major problem. But the way that the blood moves, especially like I'll tell my clients, like, hey, you got to keep busy, you got to keep active, you got to keep busy, you got to keep active. As much as a muscle grows, the heart essentially is a muscle. So if somebody comes to me and say, oh, I want a bigger biceps, I want bigger triceps, I want to work my muscles, whatever it may be, then I would tell them to do it enough, okay, enough repetitions, whatever like that, just to keep the blood circulating and it promotes muscle health, and it also promotes muscle growth. So in terms of the heart, is the most important muscle that you'll have in your body, and you need to keep active and you need to keep the blood flowing, not only through your heart, but the blood flows through your heart and through the rest of your body. So your legs work, your arms work, your brain works, and everything else works. So everything works in accordance. So it's very important for heart health is to stay active and keep the blood circulating and keep the blood flowing. Because one of the things is if anybody rehab from any injuries or whatever, you know, of course I'm a former athlete. So one of the biggest things coming back with rehab and rehabilitation is just to make sure that before you start to go 0 to 100, they slow walk you in there. They make sure that, okay, well, the swelling is down, you don't have no inflammation, but then it also gets to make sure the blood is circulating through the area that's hurt, because it also promotes healing. So in terms of the heart, it's going to promote healthy heart function, and it's going to keep it moving, it's going to keep it breathing, and it's going to keep everything around you, well, everything inside of you moving smoothly, so you can keep up on your day-to-day activities, and you can also live a healthy lifestyle and an active lifestyle.
Okay. So what are some of the recommendations on the level and or the amount of physical fitness one should engage in who the individual may have experienced some heart health situations, whether it was a stroke or some other type of cardiac episode?
So I'll use a little analogy. I know that we used one with the last panelist, but I like to say your body or even your heart, you know, I mean, it acts as a car. So when you're talking about somebody recovering from heart health, or how much can I do, how little can I do, what's pushing it, what's too much, what's I need to do a little more, it's all up into how you feel. Because I even think a doctor or even me, when we get these people, when we get these patients, you know, when I get these participants with physical health and, you know, everything like that I do, I have to make sure that they're adequate enough, their heart is adequate enough, their blood, everything is going. So whatever workout I give them or whatever I give them is conducive to their heart health. So if they come to me and they have something that they sign and fill out, and it goes all the way to, as we talked about, maternity. So it goes to, okay, did your mom have heart health? Did your grandmother have heart health? Did anybody on your mother's side of the family? Did anybody on your brother's side of the family? Or your dad's side of the family? Do you have siblings? Do they have it? So if the answer is for any of these is yes. Let's say, for example, yes, had a stroke 6 years ago. I've been active, not as active, looking for a personal trainer to kind of push me forward, try to push me along. So I could get better cardiovascular, and I could get better with my health and everything like that. I would suggest stationary workouts at first. So basically, stationary just means right there where you are. A certain type of exercises, but you're still moving, but your heart rate isn't climbing to the max or to the climax of what it can be or what it is. With somebody that has either pre-existing or has something in the past, you want to be able to slow walk them as much as possible. Now, I'm not saying don't do anything at all, because also that, as we spoke before, that will hinder you. So we got to make sure, yes, you're doing something, but you're doing the right things, low impact, a steady heart raise instead of 0 to 100 right away, because that could also bring problems too, especially you really don't know, like it's different as we talk about the muscles. I could get under the bench press, I could get under the bar, whatever like that, and I could test my muscles that way. The only way you can really test your heart is if you're doing a strenuous activity. And we don't want to take a chance with doing that strenuous activity and your heart, which is your muscle, isn't strong enough to do it. Because if it fails, then, like we said, we have a very big problem. So we got to be able to make sure that we know all the background details, and we got to make sure that we're slow walking them in there. So I would recommend start with stationary workout, something that you're used to, something that is good, maybe break a little sweat, if that, but something to get your heart rate slightly up gradually to the point where you feel good and you feel, okay, well, amongst my trainer's recommendation, I think I could press it a little bit. I could do a little bit more. I could do a little bit more. Hold on, I'm not feeling right. Let me take a step back, and then we could find a great middle ground or a great median where you're where you need to be. You're getting the workout, you're burning the calories, you're reaching the goals that you need to, but it's not like you're full on sprint every single workout that you do. So and of course, more than the next person, adequate break times in between.
Okay. Next question. I'm just going to move. You actually answered one of the questions that I had coming up next. So what are some of the benefits of exercise for the heart? Like, does it lower the stress? We've heard about exercise helping to decrease stress, weight control, blood pressure, and things of that nature. So what are some of the benefits of exercise to the heart?
It definitely does all of those things. So you're spot on with your research. It definitely does all those things. It helps lower stress. It helps with the blood circulating through your entire body, not only just your heart. But the biggest thing, it releases endorphins, and that's a scientific term. Long story short, what it is, it's whatever the peaceful, calm, tranquil thing is in your life. Usually after you work out, some people pick. I mean, if you got to go to work, some people pick after, some people pick before. A lot of people that I know, they say, I would rather work out before I go to work or I do anything else. Why? Because you get to release your endorphins. And then everything that, usually is probably catty to you that you think is going to set you over or stress you out or whatever like that, your endorphins are released so you don't have that same stress. And we know if we don't have that same stress, we don't have the same heart stress, and we don't have the strenuous activity. Like, it doesn't even have to be sprinting, but it could be something that stresses you out. And then your heart rate goes up real fast. And you're like, oh man, now I'm in trouble. This situation done got me out of hand. Working out releases your endorphins. It relaxes your body and put it in a relaxed state. So whatever you're doing on a day-to-day basis, it gets it very tranquil, and it keeps our heart rate down to where we need it, so you're not extending yourself or anything like that. So I would highly recommend anybody that has had issues or have a pre-existing condition or whatever like that, I would highly recommend that you might start your morning off with a stationary workout. If you're good and you can move up, something that gradually raises your heart rate so you can release the endorphins, get your blood circulating, so the rest of your day, everything's moving fine, everything's functioning fine, and more importantly, you feel fine, physically, emotionally, and mentally. So it's very important to stress lower any chances of pre-existing conditions and anything like that. Just make sure that you're staying active, you're staying positive, and releasing those endorphins in your workout, so you're nice and calm and tranquil, so you don't have a heart rate spike or a heart rate raise.
Okay. Now, when you speak of stationary exercises, it's not like just me sitting down in the chair,
No,
being cute, and maybe doing a couple of arm raises.
No,
Can you
no.
explain, elaborate a little on stationary, like some stationary exercises that one could engage in that's not too extraneous?
So I would say body weight squats. I know we've all did them before. Shoulder width apart, whether your arms are out behind your head, or make sure they're not on your legs. So make sure that your body is working what it needs to. That's low impact, and that's also a workout that can be done anywhere. That could be done at the gym. It could be done at home. It could be done in your basement, wherever your attic, wherever your workout station is. It could be, even if you're on breakout work and you sit on a computer all day or whatever like that, and you're like, I need to stretch my legs out. You could also do that. You don't tell your boss I told you to do this, but you could do it in between. Any break time that you get, anything you want to stretch your legs out, anything like that. Toe touches. So just like a regular stretch, or here, then back down, then back up, then back here, then back up. Any type of movement will raise your heart rate, but like I said, we want to raise it at a gradual level. You mentioned the arms. You can actually do that. That's actually another stationary workout, but I would recommend you get on your feet, and then here, then out, then here, then out, and do that to a good repetition or a good amount where you'll start to feel like it's a burn. You'll feel like, you need to catch your breath just a little bit, and your heart rate is gradually going up, and you're actually getting the exercise. One more stationary thing, instead of a full-on jumping jack, because jumping jack is a stationary exercise too, is more higher impact, meaning that you're going to get off the ground, you're coming back, and your heart rate might raise a little bit faster than the other ones. But if you're not to the level where you want to raise it up that fast, or your joints or whatever, pre-existing conditions you may have, then we could do a variation of it. So you could go over your head, and then you'll tap out to your right. Over your head, you'll tap your foot out to your left. So it's like doing a jumping jack, okay, but stationary, low impact. Get your heart rate gradually going up, but not too fast. And then you can also do like a marching high knee. So like you're standing there, instead of like the continuous high knees, where it's up, 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 up. That's a very high impact and high intensity exercise. We can just go one knee at a time. Left hand, right knee, left hand, left leg, right hand, switch, and try to get our knees as high as possible. So those are a few stationary stretches or workouts that you could do at anywhere, whether it's in the break room, at home, in your basement, or even at your gym.
Okay, and what's like the bare minimum? Because some people are not going to be in the gym 3 to 4 days a week for 2 hours at a time. What is your recommendation of the bare minimum that one should engage in every day or for the week?
There's a lot of tough. It's tough because I work with athletes, and I also work with middle-aged women with fit camps, and also do younger kids. Also do older clients and everything like that. So it's all kind of different ones, but I would say for someone who has a pre-existing condition, as someone who kind of wants to get back into the fray of things and want to warm up and want to work out, stuff like that, I would say at least try to do 2 times a week, between 40 or 45 minutes, and then gradually increase it from there. So if you think 2 is good, and you're like, you know what, I could go another day, or just I'll go one day where I'll walk for 30 minutes. And it won't get my heart rate up too fast, but I'll burn a little bit of my extra calories that I need. Then you can also do that also. So coping all them things together would be good for it.
Okay. Well, thank you for this segment, because we also are coming back to you in a little while to get the heart moving a little bit. So we're going to turn this back over to Linda at this time. And thank you, Mr. Henderson. We will see you back shortly.
See you soon.
Sora Simpson, you are muted.
Thank you so much. I'm just talking to myself. At this time, we would like to hear from our warrior survivors. First of all, Ms. Pam, if you would answer this question to the best that you feel like you would like to divulge.
Sure.
As a survivor of a heart episode, were you aware of any underlying conditions prior to it happening?
Thank you, Linda, and good evening, everyone. And thank you for inviting me to your heart health event. My situation is a little different because I was born with a congenital heart valve defect, which was detected at birth. So I was born with this disease and had 3 open heart surgeries by the time I was 30.
Okay. So with that, was there any family history? I mean, you were born with it, but parents, siblings?
Yes, unfortunately, heart disease runs in my family. My great-grandmother, my grandmother, my mother, and my nephew all have some forms of heart disease. Unfortunately, my condition is the worst condition out of the family, and I've had the most surgeries. My nephew, who is the next in line for having severe heart disease, he's had 1 surgery so far, and he is probably on his way to his 2nd surgery in the near future.
Oh, thank you. Also, and we're going to come back to you, Pamela, I would like to ask Angela the same questions. Angela Lee, are you still there?
I'm still here.
Okay.
Okay.
As a survivor, were you aware of any underlying conditions?
Yes, I was made aware of before I had the open heart surgery in 2018. In 2015, I was made aware that I had an enlarged heart. And heart disease, unfortunately, runs through my family as well. And from my pregnancies, I had 2 children. I lost one initially, and then I ended up having another daughter. But through both of them, I learned that I had high blood pressure and had to take high blood pressure medication. And my mother, when she was in her early 30s, she had her first heart attack. She ended up having 2 strokes after that and died young at the age of 42. So, yeah.
Thank you so much. And we're going to go back to Pamela for a moment, and Angela will come back to you as well. This question, feel free to elaborate, but what is your greatest challenge? You've had to deal with it all your life, but what is your greatest challenge dealing with your disease at this point?
I think best to describe it is to give you some background on the history of my heart disease journey. So my first surgery was at age 7 to repair my aortic valve. Unfortunately, it was not successful, and at age 13, my valve was replaced. I'm on blood thinning medication, and I was told that I would not be able to have children. And being so young, it didn't impact me one way or another. However, as I got older, my desire to have a child increased. And due to a significant amount of tests that I went through, my cardiologist felt that my heart was strong enough to withstand the stress of a pregnancy. So at age 30, I was pregnant. 8 weeks into my pregnancy, I was put on bed rest due to complications. And at 33 weeks into my pregnancy, I went into heart failure. A clot formed on my valve and prevented it from opening and closing. Doctors feared the clot would break off, travel to my brain, I would have a stroke and die instantly. The medical team performed a C-section to deliver the baby, and 24 hours later, my mangled valve was replaced for the 2nd time, thus my 3rd surgery. My son weighed 3 pounds, 8 ounces, and thankfully he does not have any heart issues. A few weeks ago, I was diagnosed with an aneurysm on my aortic root, and I will be undergoing my 4th open heart surgery on March 1st. And although this is not my first rodeo, it definitely feels like I'm entering uncharted territory once again. I will have a new chapter to my survival history, but I don't think you can ever get used to this disease and going through surgeries and challenges. So I would say since birth, it's been a challenge. I've lived with it my entire life. I don't know anything other than living with heart disease. So I've dealt with it and dealt with it as best as I can, living a normal and healthy lifestyle and life. So I feel blessed. I have my son, and I really have not been wanting for much in my life. So again, with good health, good doctors, I am where I am today, and I will continue to have challenges because my condition will always be with me. I will never be cured, but that's okay. I've learned to live with it and live as best as I can with this disease.
We thank you so much for that testimony. I'm sure that's not easy, but it sounds like you have a great support system and you know where you're going with this. So yes. Thank you so much for sharing that. Angela, can you express any challenges that you're dealing with at this point?
Well, the challenge has always been for me is weight. Making sure that I keep myself at a certain weight or controlling any type of weight gain. Gaining a pound is even risky for me at this point. But I was a heavier teen and was heavy for most of my adult life. I was, by standard, I was considered obese, but for the majority of the women in my family, I was probably an average weight. But that is the biggest challenge with making sure that I keep the weight down, which keeps the blood pressure down, and the less stress that I have in my life, the better off that I am. So trying to maintain a positive outlook on things. Pam, my heart goes out to you. It really does. The challenges with heart issues have only been with me for like the last 5 years or so. The most that I can say as far as a lineage, my mom had heart disease and my grandmother had it, but dealing with them personally one-on-one like that has not been my story. But it has definitely been life-changing since learning that I had this enlargement on my aorta and had to have that addressed.
Thank you so much. As I said in the beginning, both of you are warriors as it comes to heart disease. I'd like to turn it back to Dr. Palmer just for a moment. Of course, we have a bunch of questions that we can continue to ask, but given that we have our 2 survivors here and they're telling us of their family history, can you elaborate a little more on that? Is that something that is very common when people come to Deborah, that it's a history in the family that has caused this disease to manifest itself in the way that it has, or is there something else?
Right. So, I really appreciated the stories that Pamela and Angela gave. And, the family history is so important, especially, with regards to what we call congenital heart disease that Pamela has, because there's some, congenital conditions that have a very strong link to family history, meaning that, if your parent had it, then the chances of you having it is even greater. So knowing that family history with regards to congenital heart disease is important, because dependent on what that person's family member had, then that might guide my testing of that patient and MC in the office to really see if that patient has any associated conditions. And if they do, then also managing those effectively, right? So, the congenital disease might be very serious, as in Pamela's situation, or might be just something that we need to watch and guide treatment in. So very important. Now, for acquired diseases, family history is also important, as I had mentioned earlier on, if you do have a family history of premature heart disease. There are other conditions like electrical abnormal heart rhythms that could be linked to family history. There's a condition called what we call long QT syndrome that has a very strong link for family members. So if there's a family history of that, there are other conditions that particularly very relevant in African-American population, something called hypertrophic cardiomyopathy, or HCM, if any of you guys have ever heard that term. What that really means is a genetic condition where the heart just gets unusually very thick and may pose that patient at increased risk of sudden death. So if you've had a family history of that, then very important that you let your physician know, because then that would indicate to me that I'll need to have a definite, an ultrasound of that patient's heart to look for that condition. As a matter of fact, that condition has been shown to be the #1 cause for sudden death in athletes. I'm sure, it's very earth-shattering when you hear of a young athlete at the prime of his career suddenly collapsing on the court and dying. And this still happens, not very frequently, of course, but when it does happen, it's very catastrophic, So that family history is very important.
Thank you so much. At this time, we're going to ask Dr. Palmer, Pam, or Angela, if there's anything else that you would like to share, either about your story, about yourself. We don't want to miss anything that you want to share with our audience so that they too can learn more about heart health. So if there's anyone that has something else that they would like to add.
I'd like to add something, like with Pam's condition, she was saying how that she's known all her life, that she's had these concerns and had to watch. So she's had doctors following her as she's grown up. And for me, I learned through it, just the technician who just happened to be a little overzealous in his explanation when doing an echocardiogram. He was like, "Oh, you have an enlarged heart," and that was something that was never explained to me. So when it was just blurted out at the appointment, I went and talked to my cardiologist and asked him what was going on. So he described to me what they consider the parameters of an enlarged heart. He said what I was dealing with at the time, it was an allowance so much that the expectation was that the size of the enlargement would be no more than a 3.7. And at the time that I was experiencing problems, it had grown to a 4.1, yes. And it was described to me that nothing could be done until it was at least a 5. So I'm home, I'm in the house, just doing some work on a snow day on my laptop, and my teeth started hurting. And I couldn't figure out what was going on with my teeth, and then it radiated down my throat. And then all of a sudden, my heart just started racing really fast. And this was a few years after I had gotten down to the business of me having this enlarged heart. And my cardiologist did let me know if I did experience something like that to get to the hospital right away. So in getting to the hospital, the doctors did not take my word that I had been told that I already had this enlarged heart and what was going on and what we were expecting in terms of surgery when it reached a 5.0. I sat in the ER overnight, and that morning when they finally listened to what I was trying to convey to them about my situation, they were almost taken off guard by what they had to tell me. I was whisked away into emergency surgery within an hour and then told that I had like less than a 10% chance of survival. And in that experience, I had to literally tell my daughter who was a college age at the time, I had to tell her goodbye. I literally thought I was leaving because the hospital attendants or the doctors at the time did not take me seriously when I explained that I do have this information from my cardiologist. This is what's going on. And they just, at some point, wanted their own information for themselves, which I can understand. But if I wasn't an advocate for myself at that time, it would have been a very different situation.
Thank you so much for sharing that, because it's very important that we, as African Americans, as women, just as young people, that we have to advocate for ourselves. So thank you so much for that. Anyone else that has any more that they would like to share?
So I am okay.
Yeah, yes, thank you, Linda. I just want to let all the women on the call this evening know that heart disease is the #1 killer of women above all cancers combined, and it causes 1 in 3 deaths each year. Approximately 1 woman every minute it's killing, and surprisingly a lot of people aren't aware of that. And I do invite everyone to visit the goredforwomen.org website. It is a comprehensive platform designed to increase women's heart health awareness. And just a little bit of background with my involvement in the American Heart Association. About 15 years ago, I joined the American Heart Association as a survivor ambassador. And in 2010, I was chosen as the National Go Red for Women spokesperson, traveling around the tri-state area, telling my story and trying to encourage women and men to take their health seriously. I was picked to be a model on Project Runway around the same time in an episode of Real Women with Heart Disease. And it showcased us with heart disease, and we were privileged enough to share our story on television. And also I'm on the Silent Auction Committee and recently the Executive Leadership Team. So I am really just into the American Heart Association and their mission. And for me personally, I am grateful for everything that the American Heart Association does and to have them in my life. The most important impact that they've had on me is in the research area that helped support my surgeries.
Thank you so much. Dr. Palmer?
Yes, hi. So I just wanted to also touch on 3 main points, and I'm really glad that Angela had shared her story, because her story is unfortunately one of many. You know, when you go to the healthcare or to the hospital or the clinic, you have to advocate for yourselves. If you know, make sure that, you know, if you do not understand the medical condition that you have, that you get that explained to you by your physician, because that can be the difference between life and death. If it even means for you to print your history and keep it with you in your wallet at all times, or even on a chip, you know, a thumb drive, because, you know, you're right. I mean, sometimes the physicians, you're telling them that this is what I have, and they're not listening. And time saved can save your heart. So that's one thing. The last 2 points I wanted to make, and I'm really happy that Pamela had raised that February is Go Red for Women. So for all of us on this call, you know, for those of us who are above the age of 40, there's something called a Well Woman's Visit. And this is not a visit to the gynecologist, this is a visit to your cardiologist, where I've had many patients, they're healthy, but they're coming in to get their numbers checked, their glucose, their blood pressure, their cholesterol, and EKG. And that can really make a difference, because attacking the issue early is very important. And then the last message, of course, we're in the era of COVID, is that I highly encourage everyone to get the COVID-19 vaccine. I'm on a mission for that. You know, unfortunately, within our community, there's a lot of hesitancy. And I'd just like to encourage everyone to get registered and to get the vaccine when it's your time. Thank you. And
thank you so much. We've gotten so much great advice just in the past 5 minutes that is just invaluable. So I thank all of you for sharing with us. And we'll wrap up some of those points. I've been writing it down as we've been going along. But at this time, I would like Mr. Henderson to come forward and share with us this little activity that you have for us so that we can keep our hearts healthy.
All right, good. So I'll stand up. I'll move the things from behind me so you guys can get a full body shot, and then I'll go over about maybe 5 exercises that you could do, like I said, at home, at your workout space, at your workspace, at the gym or wherever it is, and that way you can keep your heart rate where it needs to be, and then you can keep your heart healthy. All right. Okay, everybody can see me? Ooh, there. Still there. All right, guys can see my body. So the first thing, okay, is a jumping jack. We really don't need, I'm a little bit taller and longer, but really don't need a lot of space to do a jumping jack. All right, so straight up, all the way down, straight back, all the way here. Okay, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Now, if you're just getting started, then you could go up until about 10 or where you feel comfortable. Like I said before, your body is like a car. So if you feel like you can press it a little bit further, make sure you guys increase it. All right. A good number is 20. All right. So even when I'm warming my athletes up, or my fit camp people, or my weight loss people, I make sure that I start them out about 10. If I feel like 10 is too easy for them, then they'll go to 20. But if you have a pre-existing condition or you want to gradually walk up to it, okay, probably start out with 10, maybe 3 sets. All right, so after 3 sets of 10 of the jumping jacks, all right, that'll be the first exercise. Now, like I said, for low impact and you don't want your heart rate to raise as much, you're like, hey, I'm a little skeptical, I want to, then as I said before, leg out, 2, 3, 4, all the way up till 10, okay? And then you'll do 3 sets of 10 of that. All right, now that's the variation of the first one, okay? Next one is reach throughs, okay? So this is actually like a standing crunch. So anybody that wants to lose lower body fat or work your arms, anything like that, make sure you come here, reach through, then all the way up. Reach through your legs, all the way up. Reach through your leg, all the way up. Reach through your legs, all the way up. Okay? Those are called reach throughs. You can also do those 3 sets of 10. Or if you feel like you get a little bit of short of breath too fast, you can try to go 5. So 1, 2, 3, 4, 5. Okay? If you're good, about 10. Okay? Or 20. Now, if you want something that's a little bit higher impact, you jump at the top of that. Reach through, up. Reach through, up. Okay? But that's at a little bit of a more advanced level. Okay? That's the second exercise and the variation. The third one was actually the first one I gave you guys. Is maybe the more simpler one that doesn't take up a lot of space. Is a regular body squat. Feet shoulder width apart, arms out, or however you want. Just don't put them here because then it assists you with your squat. So let's keep them out here like Frankenstein. All the way down, all the way up. Keep them up. All the way down, all the way up. That way I know that I'm getting my full depth all the way down and going up, okay? Like I said, if we want to kick it up a little bit, we can not only speed up the squat, but we can also get a little jump at the top. And then land back down in that position. All right, my legs are burning already, okay? So that's 3 exercises and a variation. Another thing, all right, Bianca kind of alluded to it, as she was saying in our office chair, but you can do it standing up. Slight leg bend. These would be bicep curls. Those are straight arms, okay? So you could combo that together, or you could do it separate. For this instance, we're going to combo it together. Up, out, up, out, up, out, up, out, up, out. Okay. I usually have do 3 sets of 20 of those. If you feel like that's a little bit too much, you can start at 10 or just do one of them. And then you could make this a total separate exercise. But if we feeling like we're overachievers as we are, we're here, we're here, we're here, we're here. Okay? So that's the 4th exercise and the variation. All right? The 5th one, nice and simple. The 5th one, nice and simple. Okay? Now we can handcuff it behind our head. All right? We want to twist. Now, low impact, you take it from here, you go opposite knee, opposite elbow, opposite knee, opposite elbow, and you don't got to go terribly fast. You can just 1, 2, 3. That not only will get your heart rate up, but it will also, the unsightly area, the obliques, will also work that out, okay, in the lower end of our stomach, okay? Now, if we want to be overachievers, as we are, we want to pick it up a little bit and say, this is too easy. I really want to test myself. I want to get a good workout in. I ate something bad and I want to burn the calories. Get up off our feet, twist, 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 twist. All right? That's the 5 exercises and the variations. But because I love you guys, I'll give you one more. All right? Let's be nice and wide, feet further than shoulder width apart, okay? This is also working our obliques, also working our abs. Okay, so we could go opposite touch and then out. 1, 2, 3, 4, okay? And then we'll switch sides. We could go 10 and 10. Like I said, we're overachievers. Then we could go 20, okay? 1, 2, then switch sides, 3, 2, 1, and then switch sides. These are all stationary things that we could do. That's 6. Now, I'll combo one thing together, all right? So we're gonna combo the jumping jack into a high knee. Now, this is for next level. We wanna push ourselves. Stationary, I don't got a lot of room to work with, but I really wanna, get it going. We can go jumping jack, high knee, okay? And we'll go 1 up to 10. All right, so we'll do 5. That's all I got for you tonight. 1, 1, 1, 2, 1, 2, 1, 2, 3, 1, 2, 3, 1, 2, 3, 4, 1, 2, 3, 4, then 5, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. All right.
Thank you. I'm tired just sitting here watching you. So tonight, our purpose was to share with you or get as much information as we can regarding heart disease. We have an excellent physician who is right down the street at Deborah Hospital, which a lot of us know the facility well, having people in their own families that have visited Deborah or been treated there. We have physical fitness personnel that, willing to share whatever he can to get us heart healthy. And we have our wonderful survivors. I can't thank you enough for telling your story. I think sometimes we get in situations with our health and we don't share and we don't let anybody else know what we've been through for whatever reason. But sometimes you have touched someone's heart tonight to make them consider, doing some of the things that they need to do to get heart healthy. So at this time, we've had our questions. We have, I believe there's one question in the chat. Barbara, if you could read the question and we will pose it to our panel.
Yes.
Thank you.
Yes, the question is, can you hear me?
Yes.
Okay. Are wearable devices that measure heart rate, including resting heart, good monitoring devices to access heart health?
Dr. Palmer?
Right, so that's a great question. At last year's American Heart Association, the national meeting, not last year, the year before in 2019, before the pandemic, they actually had presented some research with the Apple Watch and actually monitoring heart rate, and that actually can be very useful, especially if you do have a history of an irregular heart rate like AFib. It can actually detect if you're having a very rapid heart rate. Of course, it doesn't replace an EKG, but it can inform you that there's something wrong with your heart rhythm, and therefore you could then prompt you to see your cardiologist. So it's very useful. I know with regards to fitness, that's something that some trainers actually use to make sure that the heart rate is in the calorie burning zone. And I know that Darvin could probably speak better to that than I can. So there are ways in which it can help you to achieve and maintain a heart health.
Thank you. I believe Bianca has a question.
Yes, Dr. Palmer, during your presentation, you added in tidbits about one's maternal health and how your health was during your pregnancy. I actually just had my daughter 11 months ago, right before the world went on punishment. And I actually had her at 29 weeks because I had severe preeclampsia that I did not know. I went for my glucose testing and, did the check-in and did my blood pressure, and my blood pressure was like out the roof, and they sent me directly to the hospital, and I delivered 24 hours later. So what are some things that I should have known? Like, I didn't have up until that point, my blood pressure was slightly elevated, but it wasn't to the point where it was alarming. And there was no swelling, none of the conditions that they say comes with preeclampsia that I experienced. So what are some of the risk factors that one who is pregnant should look out for beyond her health, maybe the pre-health of her family members?
Right. So I'm happy you share that story with us, because that history, if I were seeing you in the office, would clue me that, your risk for heart disease in the future is higher than someone who did not have that history. And I mean, it doesn't commit you to a poor heart health. It's just, it clues you in that, okay, this prompts me that I need to make sure that my blood pressure is well controlled and cholesterol and such. So what can indicate to you if you're pregnant that you're having signs or trouble is if swollen ankles, as you said, you didn't have that, but for a lot of women, they may have swollen legs, especially if it's unusually swollen, if it's painful. Other things, especially if you're seeing OBGYN, if they do check your blood pressure, I always make it a habit for them to tell me what my blood pressure is, so I know. And also for you to even get a scale and a blood pressure machine while you're pregnant. Because if you're seeing that you're gaining like 5 pounds in a 24-hour period, that cannot be fat or baby weight. That has to be fluid. So that can indicate to you that, okay, I'm probably retaining more water than I should be. Let me call my OBGYN. A blood pressure machine, you don't have to go crazy with it, but at least once, every other week, you should be checking the blood pressure, especially with your history. If you were to become pregnant, I would definitely urge you to make sure that before you become pregnant, that you start that healthy lifestyle. You have to think of the pregnancy as training for a marathon. And if you're healthy entering into that pregnancy, meaning that you're at a healthy weight, your blood pressure is well controlled, your cholesterol is well controlled, your risk for having these untoward events during the pregnancy is lower. And then beyond the pregnancy, with that history, it's very important, even at your age, to have a well woman's visit with a cardiologist with that history, and then making sure that at least once a year, even if you're not pregnant, that you're seeing the physician and making sure that you're maintaining all of those indices of health with low blood pressure or healthy blood pressure, healthy cholesterol, healthy glucose, healthy weight, definitely no smoking. So, and being physically active. So those are some of the things that you can do.
I have another question that was texted to me. What is the impact of COVID and heart diseases this time?
I'm glad you had mentioned that. So, you know, with the COVID-19 infection, you know, we're just learning, you know, every month we're learning something new. But what we did see, especially as we were halfway through this pandemic, is that a lot of patients who had this infection, that it was not just a simple pneumonia and a respiratory issue. This disease affects every organ. I mean, I was even reading a couple of nights ago that COVID-19 can even have effects on your eyes. But with regards to your heart, they usually patients who have this infection, for some patients, they may develop an inflammation of the heart called myocarditis. That's usually manifested by fatigue. You may have shortness of breath if the heart muscle becomes weak. For some patients, they may have chest pain with that. And that's something that's detected usually with what we call a cardiac MRI, which is a more advanced type of imaging of your heart. If it's very, if it has caused the heart muscle to become weak, we can detect that with an ultrasound of your heart, something that we call an echocardiogram. Now, the other effects on the heart can be, you know, even for patients who may not have required hospitalization or even medical care. What we're finding is that patients who have had this COVID-19 infection over the long term may develop symptoms, what we call the long hauler syndrome, where they have this very vague, just fatigue, palpitations, you know, non-distinct chest pain. Even today, I had a patient of mine that actually, you know, has had these symptoms. And it's really symptomatic treatment for those patients, provided you've ruled out anything more serious with their heart. And actually, as time progresses, usually these symptoms get less. Now, the one thing that we also saw with this pandemic is that some of these patients, because the infection itself can cause the blood to become very thick and clot easily, these patients were actually presenting with a heart attack, like a full-blown heart attack. And then, you know, we'll rush these patients to the cath lab. Sometimes they may end up having a blockage. Sometimes they may not end up having a blockage. So this, you know, pandemic certainly has had effects on your heart. And, you know, unfortunately, within the African-American community, we have fared very poorly with outcomes. And a lot of that, again, is due to a lot of the things that I had mentioned earlier on with risk factors and so on.
Thank you so much. So that concludes our questions. I just wanted to thank all of you for attending. I would like to thank our panelists for being here and sharing such a wealth of information. I'm coming away with this with 4 points that I think everybody has mentioned in some way or another. Our lifestyle is very important, which includes our food, our exercise, everything that we do. We need to advocate for ourselves. No one else is going to tell us, you know, everything that we need to know. We need to know the signs, especially women. We need to know the signs of, you know, possible heart disease, and getting that well women visit. I'm calling my doctor tomorrow. I'm going there. I think that information is just so important. So I thank you again. I don't know what else to say. This has put my heart in the right place for Heart Health Month. At this time, I would ask SORA President Nicole Carmichael if you would have a few words.
Sure. Hi. Good evening, everyone. I'd like to thank you for attending the Trenton Alumni Chapter Delta Sigma Theta Sorority Incorporated Health and Wellness Speaker Series, Heart Healthy. Thanks to our panelists, the survivors who shared some pertinent and vital information tonight. Your testimonies and knowledge have equipped us to live better lives. And to our audience, even if the information that was shared doesn't apply to you, share it with someone. We also thank you for joining us this evening. I would like to thank SORA's Linda Wyatt Simpson, Bianca Taylor Davis, Monica Kelly, and the Health and Wellness Committee with planning this informational session. And as usual, we could not do this without our Information and Communications Committee. If you haven't completed the evaluation, Sora Wyatt Simpson will drop the link again in the chat, and good night.
Thank you.
Thank you.